Good evening, ladies.
Good evening.
Sister.
Sorry,
Good
we
evening,
have
mom.
network challenge over here,
Okay.
but the network has been changed, so I've connected. And please, I want to apologize that I didn't send the slides. I had challenge with my Bluetooth in the system. Can you please mute yourselves?
Yes, I'm muting all of us. So when I mute, then you will mute yourself.
Thank you. So that is that. We have Yeah, today we are discussing minor disorders in pregnancy and how to manage these disorders. We know that as far as pregnancy is concerned, once it comes with disorders. It's not everybody who has the disorders actually, but there are not many that do not have it. Many women experience some minor disorders during pregnancy. These disorders, S is missing there, should be treated adequately as they may escalate or become life-threatening. Minor disorders may occur due to hormonal changes, accommodation, metabolic and postural changes. Every system of the body may be affected. Every system of the body may be affected. Digestive system. We are going to take it system by system so that you can best understand. Nausea and vomiting, constipation, acidity and heartburn, excessive salivation, abdominal discomfort, and pica. These are things that the woman is not in control of. Any odor, even aroma, can trigger nausea and can trigger vomiting. Constipation, you know that progesterone does a lot to reduce gastrointestinal motility. And then acidity and heartburn, tialism, abdominal discomfort, and pica. Nausea and vomiting, especially in the morning soon after getting out of bed. Usually common in primate gravida. 50% of the women have both nausea and vomiting. 25% have just nausea, while 25% are not affected at all. Most commonly occurs during the first 10 weeks, and this could be related to high level of the hormone HCG. Management, dietary changes, behavioral modification. Hospitalization may be necessary to correct fluid and electrolyte imbalance, especially when the person is vomiting a lot. You explain the situation to the woman, you reassure her, and then you give her symptomatic relief, and then watch her. Avoid disagreeable odors and rich, spicy, or greasy food. Drink water or other fluids between meals to avoid dehydration and acidosis. Do you know dehydration causes nausea and vomiting? I'm asking you, do
No,
you know that? Yes, it
no.
does.
Okay.
It does. Medication. Well-known over-the-counter drugs should be administered only when absolutely indicated and prescribed. So you will not say, I have been taking it. As far as you are pregnant, you should not take it. And as midwives, we should tell our women the same thing. Constipation. Constipation is quite common in pregnancy. A tonicity of the gut due to the effect of progesterone, diminished physical activity, and pressure of the gravid uterus on the pelvic colon. All this go to reduce the normal bowel function. Classmate, you said you will mute them. This is what happens when you mute the unmute.
So please, I've sent her to the waiting room. I put her there.
And some of them, it may not even be that. When they come late, management. Regular bowel habit may be restored. Emphasize ample fluids and laxative foods. Purgatives should be avoided because of the possibility of inducing labor. Exercise and good bowel habits are helpful. I mean, exercise and good bowel habits are helpful. What do we mean by laxative foods? Yes, Adams, Mercy Adams.
Sister, please, foods that can peg your bowel.
Like what?
That will makes you pass lose tooth. Like
Like
sometimes
what?
green leafy. I said like eating consummate stew. Sometimes it can peg you.
Talk like a nurse. Yes, Grace. Yes, Grace. Grace Kodua. Mavis.
Sister banana. Sister, food food that have fibers or roughages.
Good. 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 Please give her a round of applause. Or roughages. Acidity and heartburn. Due to relaxation of the esophageal sphincter and hiatus hernia, heartburn, which is pyrosis or acid indigestion. results from what we call gastroesophageal reflux disease. Gastroesophageal reflux disease. GERD. In almost 10% of all gravid women. In late pregnancy, this may be aggravated by replacement of the stomach and the duodenum by the uterine fundus, the growing fundus, most likely to occur when the patient is lying down or bending over. Can somebody help me read, please?
Management. To avoid overeating and not to go to bed immediately after the meal. Liquid antacids may be helpful. Sleeping in semi-reclining position with high pillows. This hernia is reduced spontaneously after delivery. Symptomatic treatment, not surgery, is recommended. Hot tea and change of posture are helpful. Calcium-containing antacids and the histamine A2 receptor antagonists are pregnancy category B. Example, Tums to reduce gastric irritation.
So all these things will help. The nursing intervention and those drugs can help a lot.
Excessive salivation, ptylism. Increased secretion of saliva is observed during pregnancy. It may be associated with increased intake of starch, though actual cause is not known. Management. This problem is usually self-limiting and may be overcome by decreasing intake of carbohydrates. It is not associated with any adverse pregnancy outcome.
Now, how do you manage, as midwives, how do you manage childism? How do you manage childism? That is using local remedies. Yes, Mavis.
Sister, I remember at the ANC, we tell them to take, example, dry biscuits, those dry things. Like in the morning, they can take, let me say, anything which is not too spicy or fat, containing too much fat. That one also reduces it.
You said they can take what type of Lipton?
Sister, I said that at the ANC, we tell them to take dry things like biscuits. And not to eat too much fatty foods.
Yeah.
Thank you.
Okay. What home remedies do you use? I'm asking the class. What home remedies do you use? Which hand is still up? Mercy.
Sister, please, you can encourage the client to put in more ginger into her mouth early in the morning after brushing her teeth.
Okay. Ginger and what else? Yes. Akoswaya.
Sister, please, we they add us to take a bitter cola. Sometimes we chew things.
What?
Please, we take in bitter cola.
Bitter cola is very
Yes.
good. Very
And
good. They don't even need to chew it. Just put a little piece in the mouth.
yes.
And
And
from
sister,
time
have
to
you seen this
time, let your teeth step on it. It will produce the nectar, and that is that.
Yes, sister.
Yes, and what
Please,
else?
have you seen this fruit? We have this fruit. When you chew it for a long time, it turns into a gum.
What?
We take that one also. There's
What?
this
Asa, asa,
that's the name.
What did you call it?
Asa.
asa.
Is it a fruit?
Yes, sister.
Yes.
Yes. Dry fruits.
I don't know
Time.
that one, but I know the star apple. Star apple, you have a name for it. I don't know how you call it. Sorry, I didn't know I was muted. Somebody muted everybody. Star apple, browse and bring out the name. I don't know the name, but you have it plenty when the season comes. You have it. So with that star apple, one can take a woman a whole day. She will just, it is very rich in vitamin C. She will just squeeze the nectar small into her mouth, and that is that. Yes, Lily, your hand has been up. Hello, Lily. Who was reading? Please continue. Millicent. Hello, Eric. Sorry, I'm closing by 7:15. Yes, I thought I should call you and remind that the first lecture finishes 5:15 and the second lecture 7, so it won't be possible for us to meet. And tomorrow you won't be there. Till Sunday, yeah. Thank you. Hello. Are you all muted? Okay, let me read. Due to pressure, pelvic heaviness is caused by the weight of the uterus on the pelvis of the pelvic supports and the abdominal wall. Round ligament tension. The tenderness along the course of the round ligament, usually towards the left, during late pregnancy. And this is due to traction on this structure by the uterus, which is displaced by the large bowel to be rotated slightly to the right. And then you have flatulence and distension. And this can be due to large meals, gas-forming foods, and chilled beverages. These are poorly tolerated by pregnant women. And one of the gas-forming food is beans. Eating beans at night is not the best. Now, when we talk about the beverages, particularly pregnant women produce a lot of heat, and so they may take it ice cold, and that results in that. So women should be advised, if they are to eat beans, it should not be at night. And of course, they should be careful the size of food they take. It is better to take small, frequent meals than to take bulky meals at a time. All those things cause gas, flatulence, and might be very uncomfortable. The only way they could do it is when they have this kind of discomfort, as part of remedy, you encourage the woman to take a lot of fluid, particularly warm fluid, warm water. When she takes it, it's quite soothing, and it will immediately send away the gas, which could come out through the anus or by belching. Management. Rest frequently, preferably on the left lateral position. Then you can apply local heat. The local heat could be by using what do we call it? Hot water bottle. And then you change position always. But if you can move around, it helps. Dietary modification. Don't eat too much, and don't eat gas-forming foods. If you do not need it, do not take cold beverage. Regular bowel functions should be maintained, and exercise is beneficial. When we talk about exercise in pregnancy, we are not saying you should go jumping or do football, but just movement, walking fast, running at your own pace could help. And then you could give drugs as prescribed, because you are not prescribing. Intra-abdominal disorders must be diagnosed and treated appropriately by the obstetrician. Then you talk about PICA. PICA too, sometimes the woman cannot control it. The woman cannot control it. This is a term used when the pregnant woman craves certain food and then avoids certain food or rejects other food. She could even go ahead to crave unnatural substances. If you look at what is on that table, it could be snuff. It could be clay, it could be dust, it could be charcoal. Look ahead, you will see ice blocks and soap. For me, if she takes ice blocks, if she does not go cold, no problem. But to take soap, to take snuff, charcoal, clay, those ones have no nutritional value. The cause is unknown, but hormones and changes in metabolic in metabolism are thought to contribute to this. If the substance craved for is harmful to the body or to the unborn baby, the mother must be helped to seek medical advice. When we talk about pica, I know I suffered it. And I have also seen people in different areas. In my own case, there's this pear we have. You people don't have it here. Black, not as big as the avocado. When it is not ready, it is reddish or pink. And when it is ready, it is, some are black, some are bluish kind of, very nice. Oh my God, I must take those very big and succulent ones every evening before I sleep. And my pregnancy it comes seasonally, it was during the season. Wow. When labor came and I was going to the hospital, I just said, please, when you people hear that I've delivered, bring me this pain. So my husband's cousin went and got the very big succulent ones, prepared it very nice. It's not like avocado where it is soft, you eat it like that. This one, it has to be prepared. And when I delivered, they brought it. As soon as I saw it, I felt like vomiting. I just said to myself, oh, this speaker that I teach is true. But what did I do? I thanked my husband who brought it and asked him to please put it on the bedside locker. And I turned and backed it. As soon as they left, I gave it out to people. I couldn't stand the sight of it. Now, why am I telling you this story? There are times, if you have not gone through it before, you will think the woman is just doing it. It's not just doing it. That woman too make. It's not true. I have an auntie of blessed memory. When she is pregnant, no matter where she sees an empty container of tomato puree, she will start vomiting. I have a friend. In my place, we eat pounded yam a lot. That's our staple food, pounded yam and plantain. And so it was a common thing at that time in my place that every evening is pounded yam. That was our meal. I mean, not in my house, I mean in my community, in my local government. So when this lady of mine is cooking pounded yam, as she pounds it, she first takes the one she will keep to eat in the morning because she has to eat the stale one in the morning. Ordinarily, she doesn't eat it. Talking about snuff, I have a sister-in-law, let me call her my mate, married to my late husband's younger brother. Once she's pregnant, she puts her own snuff in her mouth. So nobody knows the cause of it. The only thing is when it is harmful, try to talk the person out of it. Are there not some people who it has to be junk food? That food must come from the eatery. She could eat her own food in the house, but every day she must eat from the eatery until she delivers. Musculoskeletal system, fatigue, backache, leg cramps, round ligament pain. These pains come, women complain about them. Now, fatigue, you can see how that woman is slumped there. And to think her own pregnancy is even big, but see how she slumps. The pregnant patient is more subject to fatigue during the last trimester of pregnancy because of altered position and extra weight carried. Management. Anemia and other systemic diseases must be ruled out. You encourage frequent rest. Let her rest. And of course, in that last trimester, somebody should be around to help her so that she will not go doing the house chores on her own, so that she will have time to rest. And then the backache. About 50% of pregnant women suffer it. Physiological changes that contribute to backache are joint ligament laxity, which is usually due to relaxin or estrogen. Weight gain. You can see that this woman's own is really hyperlordosis, where the anterior is tilted, the anterior pelvis. And you can see that her abdomen here is quite pendulous. It may be due to faulty posture and high heel shoes, muscular spasm, urinary tract infection, or even constipation. But most of the time it is due to the ligament tilt of the joints. Fatigue, muscle spasm, or postural back strain most often are responsible. You will see her, she will put her hands on her waist. Excessive weight gain should be avoided. Rest with elevation of the legs to flex the hips. Improvement of position, well-fitted pelvic girdle, that is the belt form, may be helpful to correct the lumbar lordosis during walking. And while she is resting, it should be on a high bed. Most people do not like to use orthopedic bed. They think it is too hard. They do not know that it is ideal. Improvement in position is often achieved by wearing low-heeled shoes. This is done in order that the woman may achieve a proper position. Now, there is an exercise that says the woman should try to flatten her abdomen. As she does that, the pelvis is tilted forward and the buttocks tucked under a straight back. I do say it, but I know that it is not very common with pregnancy. That notwithstanding, it could be advocated to see if the woman will be able to achieve it. Because how much flattening of abdomen can you do when the main culprit is still there? You massage the back muscles by using a hot compress, like this woman is using hot water bottle, and analgesics can be given and rest encouraged. Back exercise under the supervision of a rehabilitation physician who is usually an orthopedist or a physician therapist could be done. And then you recommend sleep. What kind of sleep? Sleeping on a firm mattress. I tell you, I always I recommend orthopedic mattress for any woman or any human being from the age of 40, 50. 57 is far. Get an orthopedic mattress. It will help you. Apply local heat and light massage to help relieve the tension. It will help relieve the tension. You give drugs again as prescribed. Obtain orthopedic consultation if the condition gets worse. Otherwise, after 9 months, she's okay. Then the leg cramps. Quite common, usually in the leg. It's usually worse at night. The cause of the leg cramps in pregnancy is not known, but it is usually attributed to deficiency vitamin B1, deficiency of vitamins like vitamin B1. And some serum calcium that cannot be properly absorbed, or elevation of serum phosphorus. These are assumptions, but the main reason is not known. But when you have this, you prescribe. It may be due to ischemia and changes in the pH or electrolyte status. But one thing I know, talking about electrolyte status, one thing I know is once these cramps are there, let the person take a glass or a cup of water. A cup of water is not iced water. Most times, as she takes the water, it resolves it. Automatically, it resolves it if she takes that water. Now, management. Supplementary calcium therapy in tablet or syrup, and this should be taken after principal meals. Massaging the leg. When we talk about massaging the leg, I fear Why? It depends on who is massaging it. It can become much more painful. Application of local heat might help. Taking of vitamins like B1, 30 milligrams daily might help. And then you sleep with foot elevated. It might help. When you hear me saying might help, is that there are two things I have tried that are very helpful. Number one is drinking of that water. And number two, put your bare foot flat on the ground. Flat on the ground. It helps. Number three, you lift up your leg and bring your toes towards your face. It is also very helpful, very helpful. It resolves immediately. The round ligament pain, it can be very painful. And you know, occasionally it can happen on both legs, bilateral. Wow, can be quite painful. Stretching of the round ligament during movement in pregnancy may cause sharp pain in the groin. This pain may be unilateral or bilateral. It is usually felt in the second trimester onwards. This is more common in the right side as a result of the dextro rotation of the uterus. Pain may be awakening at night. Very terrible. Very terrible. At night, you may be sleeping and you have a sudden rollover. Wow, can be very painful. Very, very painful. If it is unilateral, you can tolerate it. When it's bilateral, you might scream. And when it happens like that, you just try to make a move. You move gently, not by force. When you move gently, it might resolve the tension. Pain may be reduced by making movements gradually instead of suddenly. Local heat application is helpful. Analgesics are rarely needed. Analgesics are rarely needed. Then you have the circulatory system. You people are making noise, so you cannot learn from yourselves. I like my classes to be interactive. But when you come like this and you are making noise, I can't ask you questions. Because you people don't believe you are big people. You don't believe you are in class to learn. Varicose veins, hemorrhoids, syncopes, and ankle edema. In the leg and the vulva, they are called varicosities. And when they occur in the rectum, they are called, rectum or anus, they are called hemorrhoids. May appear for the first time in pregnancy, or may be aggravated during pregnancy. So if that patient naturally has varicosities or hemorrhoid, it may be aggravated by pregnancy. Of course, you will not ask why, because in pregnancy there is weight, there's severe weight, so it could result in that. We are told that it is usually in the later months of pregnancy due to obstruction in the venous return by the pregnant uterus, due to smooth muscle relaxation, weakness of the vascular walls, and incompetent valves. So all these are responsible for varicosity. And permit me to say that hemorrhoidectomy is the most painful operation you can think of. The most painful operation. All those I have seen groan in pain, such pain that analgesic may relieve for a short time. Very painful operation. Hemorrhoidectomy. For leg varicosities, elastic crepe bandage can be used to put everything in position, and then elevation of the limbs during rest can give symptomatic relief. You see, when you use crepe bandage, it holds the vessels in position. So during movement, you don't have any challenge. And then when you are resting, you can elevate the legs. Elevate legs above the level of the body and control excessive weight gain. Very important. Avoid forceful massage. Wow. What could cause somebody to go massaging varicosity? Of course, ignorance. Especially downwards against venous return. And avoid point pressure over the legs. There's nothing that could make you begin to put pressure on any part of it. In more severe leg or vulvar varicosities, however, a top that garment is like a crepe bandage. You use it particularly if it is vulval varicosity. You can use it like pants, or you use tight pants to hold it to position. Injection or surgical correction of varicose veins is not recommended during pregnancy. It's not recommended during pregnancy. So you will nurse the pregnancy, you have the baby, and then after delivery, you may think of operation. If you were talking, I would have asked you how, if you have ever managed varicosity in pregnancy or labor? But you don't want to talk. I don't want to call anybody. Rest. Let all of us rest. Me too, I will rest. Hemorrhoids. Hemorrhoids may cause annoying complications, very annoying complications, like bleeding or even prolapse of the rectum. Can you imagine what it is? You go to the toilet, you clean up his blood, or the rectum prolapses. May cause considerable discomfort. Straining at stool often causes hemorrhoids, especially in women prone to varicosity. And I want to tell you one remedy that can be harsh, but very good. And that is rub. When somebody has hemorrhoid, probably you want to go to toilet and you're looking for an ointment to lubricate it, use rub. Rub is harsh, rub is hot, but it is good. I don't know the scientific principle. It's quite helpful. Apart from that, the food eaten, you should know what you eat, something that will avoid straining at stool. So for management, as we are talking, you use laxatives regularly, local application of hydrocortisone ointment, surgical treatment should be withheld until after delivery. Avoid constipation. Avoid anything that will not help. You can use sitz bath, rectal ointment. Suppositories are good. Mild laxatives. But we must be careful with laxatives because we do not want to trigger early or premature labor. I do not know about any injection treatment that should be given. So they are usually contraindicated. But the main treatment is the ability to control constipation. Very important. Ability to control constipation, ability to facilitate voiding. So if she wants to void, she could use an ointment, and that will help. She wants to void, she could use rub. It is harsh, I repeat, but it's very good. Very good. Fainting attack, syncope. The woman presents with dizziness or lightheadedness on standing upright abruptly or following standing for a long period of time. Following prolonged standing or standing upright suddenly. This is due to pooling of blood in the vital organs to in the veins, from the vital organs to the lower extremities. And it could also be due to compression of the pelvic veins by the gravid uterus. Other causes may be dehydration, hypoglycemia, or over exertion. So you take things calmly. Take things calmly. The management, you rest by the side. If you were lying supine, you insert, or if the problem is supine, insert a small pillow under the right hip. Avoid prolonged standing. Change position regularly. If fainting occurs, sit with your head lowered in between your legs. Or if you can, lie down. It helps. Syncopes usually resolve rapidly on lying on the left lateral position. In supine position, it can be managed by resting on the lateral recumbent position. Recurrent syncopes need cardiological evaluation. Encourage the patient to eat 6 small meals a day rather than big, large meals. Stimulants, spirits of ammonia, coffee, tea could be given during attacks due to postural hypotension. So stimulants are things that could raise blood pressure. So you can give them when they have their attacks. All these are the things I am sure we tell women when they come and they have these problems. Such a woman should be encouraged to sit down. Getting up, she should get up slowly. But where this thing is repeated again and again, let her see a cardiologist. There may be a challenge somewhere. She should not just sit down. Yes, Ophelia. Yes, Ophelia. You were muted centrally because you were disturbing. I didn't mute you. So we have to wait for the ICT person to come. Maybe the person is not there and so has not seen or heard that I have asked you to talk. Why don't you type what you want to say? Type it out and let us see. Because I know many more people have questions, but they cannot ask. Because you are muted. Because some people are selfish. Have you typed it, Ophelia? I'm still waiting.
Ma'am, please, I was talking about the syncopes in the spine position. I didn't get that explanation.
It says syncope in what?
The first and then the second point. I didn't get the explanation.
Syncope usually resolves rapidly on lying on the left lateral position. And if it is supine position, you put you make her take the lateral or the recumbent position. This I mean, when you talk about supine syncope on the supine position, it is something that any midwife knows immediately. What is a supine position? Hello. Yes, Mercy. Mercy Adams. Who can tell us what a supine position is?
It's a lying. It's lying on your back.
Period. Lying on the back. And so if your syncope, that it is happening because she's lying on her back, you turn her to the recumbent, the left lateral position. Is that not the position we recommend for women? That's the position we all recommend for women. Ophelia, are you okay? As soon as you finish palpating a woman, you turn her to her side. Is that not what we do? Is that not what we practice? Because you don't want her to remain in the supine position for long. To avoid, what do we avoid? As midwives, what do we call that thing? We avoid by making the women turn to the left side, to their side. What are we trying to avoid? Hello. I'm asking because some people may be doing it and doing it routinely. Have you ever heard of supine hypotensive syndrome? Yes, Ernestina. Yes, Ernestina. Ernestina. Ankle edema. this is evidenced by marked gain of weight. The person gains weight. Somebody who does not know might think she is healthy, but the weight gain, most people will know there's something wrong. Weight gain. Like you can see it elevated there. So that once that happens, check the blood pressure. Because the next thing could be eclampsia. Develops in at least 2/3 of women in late pregnancy. And this is due to water retention and increased venous pressure on the legs. Where there is generalized edema, it is a very serious condition and must be investigated more thoroughly. Edema generally calls for investigation. You only relax when the woman tells you, oh, when I lie down and wake up the next morning, it is not there. Then you know that is physiological. You can relax. But when she sweats like this all over the body, no. When she has it, even first thing in the morning, as she wakes up, it is not the best. Something has to be done. There's something wrong somewhere. No treatment is required for physiological edema or orthostatic edema. That is because it subsides on rest with slight elevation of the legs. Diuretics should not be prescribed. Treatment is largely preventive and symptomatic. Patients should elevate her legs frequently. Restrict excessive salt intake and provide elastic support for varicose veins. Diuresis may reduce edema temporarily, but may be harmful to mother and child. That cannot be overemphasized. Where the edema is more than that, usually it's eclampsia. And so care must be taken to prevent fitting. How do you do it? Every attempt should be made to reduce the blood pressure. It is very important. Nervous system. Insomnia, headache, carpal tunnel syndrome. This is relatively common in late pregnancy because of discomfort that is caused by, will I call it excessive fetal movement? Number two, frequency of micturition. And number three, difficulty in finding a comfortable position. Those are the major things. But this fear could, this anxiety, the insomnia could also be due to anxiety, deep-rooted fear. What could cause the fear? The old women's stories, tales that they have heard. Who told you can go into labor and come out like that? You can't. The pain of labor, no, you can't try it. And because of those tales, when I am conducting delivery, I put the patient in suspense. What do I mean? Even when she is in second stage, I will tell her the pain has not started. So you better conserve your energy for during the pain. You can shout. And most times they will ask me, Madam, you mean this pain? There will be more than this. I say, you don't understand what labor is. Just conserve yourself, your energy, so that when it is time, you push out your baby. And so the pain will come. The woman will be expecting more pain and conserving herself until the head is at the perineum. She will be expecting more pain until the head is born. She will still be expecting pain. Internal rotation takes place. And the next thing she will know is that the baby is born. Because they come in with so much anxiety. They have heard so much. One of my colleagues, a nurse, probably as she sees and conducts delivery, she sees women crying and all that and shouting. Her first baby. She told the midwife, please call my husband. And the midwife didn't know what was going on, so she called the husband. And she looked straight at the man's eyes. Sorry, I will not make it. I will die. I won't go through this. That man would have died because he got into his car and drove to an unknown destination. Out of fear that his wife was going to die. Nobody knew where he went to. Only for him to come back. And everybody was telling him, congratulations, congratulations. So this kind of fear makes women not to sleep. They cannot sleep. So that if you are opportuned, To be on duty at that time, you need to encourage the woman. For frequently in maturation, there's nothing you can do. Fetal movement, there's nothing you can do. When she cannot find a comfortable position to sleep, you just prop her up. And all you do is give her soothing words. Don't worry, it will soon come to an end. It will soon end. It will soon end. And when she is in labor and she tells you, madam, I hear this thing is very painful, or you tell her, yes, it's painful, but when the pain is coming, when the real pain has come, I will let you know. So by the time she will be waiting for the real pain to come, even in second stage of labor, she'll be waiting for the pain to come. She will not see the pain because you will never let her know. But the pain will be there. You know, that is real psychology, using psychology on the patient. Using psychology on the, just tell her, cooperate with me. When I tell you what I tell you to do, you do. When the pain comes out, tell you the pain has come. And then you have done, and of course, you know that is true. It's coming. Who on the bed? That is why I am in uniform and I'm here, which is the baby's head. And once it comes out, restitution takes place. Internal rotation takes place. The shoulders have entered the AP diameter. What else will she shout for? It is all over. You put your hand and bring out the baby. And then she'll be saying, Ma, thank you, madam. Management. Let her take her rest in the afternoon. Encourage her to rest. But do not encourage her to sleep. Because if she sleeps in the afternoon, she'll not be able to sleep at night. Rest, generally, we encourage pregnant women to rest, but discourage sleep. Make her drink a glass of warm milk, a glass of a beverage. If she's feeling warm, it could be cold one, as she can tolerate. Make her take bath, warm bath. Even if it is hot, if the weather is that. But if the weather is hot, let her take a bath. Warm bath will send away blood from the vital organs. Let her sleep with open windows and in an airy place. Put off the lights. Tuck a pillow under the abdomen, even as she's lying on the lateral side, on the side. This will help position, make it firm and reduce the severe movement. talk about her fears, talk about her anxiety. If you talk about it, she will be light. She will feel fine. You may want to talk about it and she will not talk. Why can't you sleep? Are you afraid of labor? Have you heard that labor is very painful? She might open up. And then you tell her, no, not so. It is quite painful, but you just listen to the midwife. When the pain is severe, the midwife will tell you the pain has come. When she tells you to push, push, the woman will relax. She will know that she's in safe hands. Headache. Headache in pregnancy is common. And that is because of the tension that goes on. But when this headache is continuous and severe, there's a problem. They become a problem. When she begins to complain about refractive problems, wow. You must seek medical advice. She tells you, I don't see well anymore. She is going towards fulminating eclampsia. Bring her immediately on admission. Severe persistent headache in the third trimester is pointing towards eclampsia. And so she must be admitted immediately. Her vitals should be checked, particularly her blood pressure, and let it be controlled. Particularly her blood pressure. She'll be tilting towards eclampsia. So you don't joke. In fact, all through the pregnancy, as she's complaining of headache, check the blood pressure. Second trimester, it could be pregnancy-induced hypertension. Second trimester, getting towards the third trimester. Particularly if she is a teenager. Don't take the headache for granted. I say she is a teenager because pregnancy-induced hypertension is usually common among the teenagers. Carpal tunnel syndrome. This is a condition where there is pain and numbness in the thumb, the index finger, and the middle finger. The muscles of the thumb go weak or soft, and so the thumb can hardly move. This condition is due to compression effect on the medial nerves. Physiological changes in pregnancy cause retention of excess fluid in the body, and this puts pressure on the medial nerve. So what I want to say here is, when that happens, you may be given this to take, given that to take, this may be prescribed. You will be given a ball to be holding in your hand, to be pressing it like somebody who has stroke. Most times there will be no relief. Relief only comes after delivery. When the woman has delivered, then there is a relief. Same is the case with pregnancy-induced hypertension. As soon as she delivers, the blood pressure normalizes. Then you have the genitourinary system. You have vaginal discharge, you have leukorrhea, you have urinary symptoms. Vaginal discharge. All you need to do is to reassure the woman, because it is a common condition in pregnancy, except and unless the discharge has color and the itching becomes too much. So you reassure the patient, you advise her on local cleanliness. That is what she requires. When you wash your underwears, dry them under the sun. Make sure you are clean and dry. If there is presence of any infection, that is like trichomoniasis, candidiasis, that is why I told you that where there is color in the discharge, this should be treated appropriately. The discharge could be from blood. If she is itching too much, she may begin to bleed. She should be treated appropriately. Leukorrhea, general increase in the amount of non-irritating vaginal discharge. This is usually due to estrogen stimulation of the cervical muscles and cervical mucosa in normal pregnancy. Such conditions do not raise alarm because the discharge is usually milky. It may not be too thick, and it does not irritate. So if it is much and the perineum or the vulvar area is moist continuously, it may begin to cause mild itching, pruritus. But itching is rarely severe when there is no infection. So you encourage her. You reassure her, suggest protective perineal pads. If she can afford it, you tell her to wear panty liners and anything that she need, you think can help her. If you think she cannot afford it, let her wash herself many times in a day, dry or iron the pants, Excessive leukorrhea accompanied by pruritus or discoloration of the secretion may indicate bleeding or infection. And if that happens, it requires effective treatment. Urinary symptoms, frequency of micturition, urgency and stress incontinence, usually in the multipara are common, especially in advanced pregnancy. Due to increased intra-abdominal pressure and reduced bladder capacity, definitely this is not much of a problem. Then you suspect urinary tract infection if there is dysuria or there is hematuria. Once that happens, you know that there is a problem. And then again, you make her drink a lot of water, because normally there is no problem, except the urgency becomes particularly troublesome. Then you limit spices, you limit caffeine, you limit beverages, and you encourage her to drink cranberry juice. But this will help in maintaining the urinary acidity as well as decreasing urinary tract infection. It will act like a urine disinfectant or urinary tract disinfectant, whichever one. Respiratory system. Breathlessness and pregnancy, they go hand in hand. You cannot really say the woman is dyspneic, because it is usually due to progesterone effect. In non-smokers and other free cough or allergic problems, breathlessness occurs as early as the 12th week of pregnancy. And most women have these symptoms by the 30th week. There is no effective treatment, except and unless you have found out that there is a pathological condition beneath it. Otherwise, nothing to worry. Integumentary system. This is the skin. Some mothers complain of generalized itching, which often starts over the abdomen. This itching sometimes is believed to have a connection with bilirubin. When bilirubin levels are raised, it could be that. Or hormones, hormonal level 2 in pregnancy. So in a case like that, it also disappears when the woman delivers. So you can allow her to use antihistamine cream to rub them topically. If she complains of vulvar itching or infections such as thrush and glycosuria, that is glucose, a condition of glucose in urine, as a result of the condition of the mother, should be excluded. Then you wash with mild soap and cotton underwear, cotton underwear, might help to ease the irritation so that it is not usually a problem, except you see that the condition is otherwise. But one thing we must know is that this itching clears off as soon as the baby is born, where there is no problem. So where there is a problem, she's diabetic, you now begin to treat asymptomatically if she's diabetic or um, uh, it is infection. So here are a list of disorders that require immediate action in pregnancy. Vaginal bleeding, reduced fetal movement, frontal or recurring headache, edema or sudden swelling, rupture of membranes, premature onset of contractions, sudden nausea and vomiting, epigastric pain. Once you get any of these problems, if you are in the community and a woman comes with that complaint, send her immediately to the facility. If you are in the facility, seek medical aid. If you are in the rural area, of course, you know that you need to transfer. So we've been talking about minor disorders of pregnancy, and we have taken them system by system. What is important when talking about minor disorders in pregnancy is the knowledge to know the normal, to know the stage it is deviating, and the ability to detect the abnormal. That is what is important about it. The condition is normal, but when it begins to deviate, it should be treated. Do we have questions? If we don't have questions, can we call it a day? Some of us have to travel back home. We don't live here. Most of you are in your own houses. Please, if you have questions, unmute yourself and ask questions. Let us interact.
Sister, please, can I get the picture of the summary again?
Sorry? The summary?
Please, can I? Yes.
That is it. I said minor disorders of pregnancy or during pregnancy are common. More than 50% of women have it. But what is important about the knowledge of what we have learned today is ability to manage it, the skill to know when it is deviating from normal so that you can refer. So we have seen the ones that need emergency. If a woman comes in and she tells you, I have itching, it is normal. But where the discharge is yellowish or reddish, pinkish in color, then you know there's amount of bleeding somewhere. Then you know she is scratching too much. You refer her. You know that breathlessness is a normal thing in pregnancy. But when you notice that she is breathless and that pregnancy is not normal, so you refer her. That's what I'm saying. Are you all right?
Yes, sister, thank you.
Any other question, please? I'm begging you to ask questions so before you say you didn't understand the lesson. Okay, in the absence of any other question, can we call it a day?
Yes, sister.
Have you looked at your time?
It's not yet time. It's 7:08.
It's 7:08.
Yes.
So you have 7 minutes more. So that's why I'm asking you to ask questions if you have. If you have no questions, then we call it a day. I'm now owing you 3 slides. Please pray for me. Let me be able to rectify the challenge so I can send it to you. Rita, you didn't help me read today. Yes, okay, Florence, thank you. Thank you, Abigail, thank you. Rita didn't help me read. Dorcas, God bless you.